Hi, my name is Heidi, and I'm the founder of Aware Health. And we've been working with self insured employers to help their employees optimize their health proactively before even entering the medical system. So, we put this case study together to give you an example of what that might look like. So, let's talk about what typically happens if an employee gets pain in their back. Maybe working from home in their home office setup. So if it's work related, they would file a FROI, first report of injury form, and then they would report to work comp and go through the medical provider network or the physician on the panel to get evaluated. There probably would be some imaging involved, maybe some medication prescriptions, maybe a lawyer would be involved at some point along the way if the symptoms didn't resolve quickly, or maybe there are some work dynamics at play that cause them to reach out to an attorney. There could eventually be a progression from prescription medication to opioid medication. Hopefully less common these days, but you never know. That employee might then opt for back surgery if they feel like they can't reach their goals with the traditional system, and maybe the surgeon would say, well, before surgery, try physical therapy. So they go in for physical therapy with surgery in the back of their mind, and they said they failed physical therapy, let's go for surgery. So all of a sudden the employer has a large bill. So we instead would work with the employee the same day they develop back pain. And we'd ask them if they just want to get some recommendations the day of. So it would be in the first aid kind of category. We would do a telehealth visit with them. They would call in and on our hotline number, and they would schedule through our automatic scheduler, get a video call with the triage nurse the same day. So we're able to identify if they're high, medium, or low risk for developing chronic pain. So it helps us triage, and we use a questionnaire to help guide us determine that. And then we rule out any needs for imaging for back pain. We know there are certain flags to look for. If they pass all of that, then they get an appointment with a physical therapist the same day. A licensed physical therapist looks at them, makes some recommendations to their workstation, and what we found is within 1 to 3 visits, employees, if we catch their pain early enough, only need a first aid treatment and some observation after that through telehealth. So really doesn't take much at that point. We believe that our outcomes are fast because we get to their pain right away instead of them going through the medical system, going to their primary care or work comp physician, and then maybe eventually getting physical therapy later on down the line. So we also have some research results that we've published showing that early intervention is effective in decreasing cost and helping the employees reach outcomes quickly. So hopefully walking through that helps. 95+% of employees do well with that type of a program. It's very rare that they have to go through the typical insurance system to get care. So that's an example of how early intervention will help the self-funded employer proactively manage their employees' concerns and keep them at work and keep them happy and healthy. I hope that helps. Feel free to reach out to us on email, Facebook, LinkedIn. We'd love to start a conversation with you, answer any questions you have. Take care.